Welcome to the second video of the lower limb series. In this video, I will be talking about the structures of the leg and foot. The leg has two long bones, the tibia, which is larger and more medial, and the fibula, which is slender and more lateral. The head of the tibia has medial and lateral condyle. Each has an articular surface. It articulates with femur to form the knee joint. This is tibial tuberosity, where the patellar tendon attaches. The distal end of tibia articulates with the talus bone of the foot to form the tibio-talar joint, which is part of the ankle joint. This projection is the medial malleolus. The fibula is not weight-bearing in humans, but instead serves as the attachment point for muscles. The head of the fibula articulates with the tibia to form the proximal tibiofibular joint. On the distal end of the fibula, this projection is the lateral malleolus. The fibula articulates with the tibia to form the distal tibiofibular joint. Together, these bones articulate with the talus to form the ankle joint. The talus is the bone that makes the joint with tibia and fibula. This joint performs only dorsiflexion and plantar flexion. This is the calcaneus, the prominent heel bone. This is the navicular bone, which is shaped like a boat. This is cuboid bone, which is cube-shaped. These three bones are the cuneiforms, numbered first, second, and third from medial to lateral. These five long bones are the metatarsals, numbered 1 through 5 from medial to lateral. These next three rows of small long bones are the phalanges. The hallux or big toe has proximal and distal phalanges. The other toes each have proximal, middle, and distal phalanges. The musculature of the leg is divided into three main compartments: anterior, lateral, and posterior. The posterior compartment is further divided into superficial and deep compartments. The anterior compartment of the leg contains the tibialis anterior muscle, which dorsiflexes the foot. This is the extensor hallucis longus muscle. It dorsiflexes the big toe. And this is extensor digitorum longus muscle, dorsiflexes toes 2 to 5. The muscles of anterior leg are innervated by the deep fibular nerve. This is the lateral compartment of the leg, which contains the peroneus longus and peroneus brevis muscle. These muscles are innervated by the superficial fibular nerve. On the sole of the foot, note the attachment of peroneus brevis at the tuberosity of the fifth metatarsal. Also note the peroneus longus crosses the sole of the foot to attach the lateral side of the base of the first metatarsal. Contraction of these muscles causes eversion of the foot. In the superficial compartment of the posterior leg, we see this large muscle with two heads is the gastrocnemius muscle. Underneath the gastrocnemius is the soleus muscle. This long tendon belongs to the tiny plantaris muscle. These muscles insert into the calcaneus bone as the Achilles tendon. These muscles plantar flex the foot. In the deep compartment of the leg, we see the flexor hallucis longus, which plantar flexes the big toe or the hallux. This is the flexor digitorum longus, which plantar flexes the toes. This is the tibialis posterior muscle. It plantar flexes the ankle and toes. All the muscles of the superficial and deep compartments of the leg are innervated by the tibial nerve. All these important structures descend to the foot posterior to the medial malleolus. These structures can be described as Tom, Dick, and Harry. T for the tibialis posterior, D for the flexor digitorum longus, A for the posterior tibial artery, N for the tibial nerve, and finally H for the flexor hallucis longus. We will not discuss the intrinsic muscle of the foot. This concludes the second video of the lower limb series.